Good morning. This is Barrister Nadia Choudhury, and I am a member of the Bangladesh Awami League International Affairs Subcommittee. Women have indeed always constituted a significant part of the frontline workers while facing global crises. This is especially true in the context of Bangladesh. Not only is Bangladesh dealing with the COVID-19 pandemic alongside the rest of the world, we have also recently been impacted by Cyclone Amphan. The socio-economic impact of COVID-19 is furthering existing inequalities. Women are being disproportionately impacted due to loss of livelihoods. Restricted movement has resulted in increases in domestic and care work needs within the household and exposure to violence and abuse, including an increase in child marriages. As soon as the first cases of COVID-19 were reported in Bangladesh at the beginning of March of 2020, the government of Bangladesh has had to give emergency orders and has been implementing multi-sectoral responses to tackle the impact of COVID-19. The Honorable Prime Minister Sheikh Hasina issued a 31-point directive with special attention called for the most disadvantaged people, like agricultural workers, day laborers, rickshaw and van pullers, transport workers, beggars, street children, women abandoned by their husbands, widows and the transgender community, and their access to relief. Special priority for all doctors, nurses, lab technicians, cleaners, ambulance drivers who are involved in the treatment of COVID-19 disease was also announced in this 31-point directive. The government has provided 2 months basic salary and insurance coverage of up to 1 million Bangladesh taka as incentive for doctors and other frontline healthcare workers. The insurance coverage has been extended to government officials and law enforcers. For anyone who dies as a result of COVID-19 while in service, health insurance will be 5 times higher. 1 billion taka has been allocated as special honorarium for health officials, while 7.5 billion taka has been allocated for their insurance. In total, the Bangladesh government has announced various stimulus packages close to 1 trillion taka, amounting to 3.3% of the country's GDP. To address the impact of the COVID-19 outbreak on the economy, the Bangladesh government has allocated close to 1 trillion taka under a set of stimulus packages amounting to 3.3% of the GDP. The Honorable Prime Minister Sheikh Hasina announced a 4-point strategic plan geared towards increasing public expenditure, introducing fiscal packages, expanding social safety net programs, and increasing the supply of money. The first of the fiscal packages, involving 300 billion taka, is being provided to affected industries and service sector through banks as low-interest loans. Under the second package, small and medium enterprises are getting 200 billion taka working capital. The third package is for enhancing Bangladesh Bank's Export Development Fund from $3.5 billion to $5 billion to facilitate raw material import. Under the fourth package, the Bangladesh Bank introduced a new credit facility of 50 million taka as pre-shipment credit refinance scheme. A 50 billion taka incentive package is directed at paying the salaries of export-oriented industries. Another 50 billion has been allocated to the agricultural sector. These packages benefit women as much as they do men, since women comprise a significant portion of the workforce within the service, industry, and agricultural sectors, with a greater percentage of women engaged in the agricultural sector, RMG sector, and more women being trained as healthcare professionals in the fight against COVID-19. The 50 billion taka incentive package directed at paying the salaries of export-oriented industries has gone directly to women engaged in the RMG sector, the working conditions of which have significantly improved since the Rana Plaza tragedy, and continues upholding COVID-19 health guidelines at the workplace. Government telecommunications vehicles are used to transport farm products to markets and through online services, ensuring the food chain supply continues to be operational, impacting thousands of women in rural communities and households. Sanitary napkins are provided for free by the Bangladesh government, and helpline services are operational, providing delivery of food and necessary items to households in lockdown areas or those that are in quarantine or isolation. The government has also allocated 78.2 million taka to provide baby food assistance to the vulnerable community, from which 13.9 million families have already benefited. 3.4 million families in the extreme poor category have already been receiving monthly allowances for 3 months through mobile banking to avoid corruption and to make sure it reaches the most in need. Over 27.7 million families have received emergency relief, food, and cash assistance so far in the ongoing relief drive to tackle the impacts of COVID-19. At the beginning of the pandemic, emergency flights were arranged for those who wanted to return to Bangladesh. Since then, sadly, a large number of expatriates have died of the virus in a number of different countries. The Bangladesh embassies in these countries are keeping track of the needs of the expatriates, and the Bangladesh government is also providing financial support to those in need and to those who have returned to Bangladesh after losing their jobs abroad as a result of the coronavirus pandemic. The government is currently working on providing psychological help, skills training, and economic rehabilitation of the foreign returned workers. During COVID-19, Bangladesh has witnessed a significant increase in abuse and violence against both women and children, with an increase in child marriages. While there are national helplines and legal protection available for victims, perhaps the most important thing that has been done to tackle this issue is prioritizing mental health and psychosocial well-being during COVID-19. A national committee has been formed to look into providing mental health and psychosocial support during the pandemic. Additionally, court services are limited during this lockdown period except for emergency cases, which includes cases related to the repression of women and children. As lockdown measures have been widely loosened in the country, with money being injected to keep the economy going, it is hoped the numbers of violence and abuse cases will drop as well. To quote gender monitoring networks in Bangladesh calling for urgent, gender-responsive COVID-19 relief and response, there should be increased women's representation in COVID-19 planning and decision-making. Gender-based violence response services should be declared as essential and life-saving services, and additional resources should be allocated to ensure continued operation of justice, health, and social services for affected women and women at risk. Access to COVID-19 public health and gender-based violence prevention and response messages should be ensured for women and girls in the marginalized communities, including on child marriage, through more accessible means of communication. Sexual exploitation and abuse should be prevented in quarantine and isolation centers and during relief distribution through adopting a code of conduct, training personnel, and distributing information to beneficiaries. Economic response and recovery packages should be designed with a gender lens, assessing their impact on women and men. And a nationwide advocacy and media campaign should be launched, inclusive of disabilities and other diversities, to address and prevent gender-based violence, end child marriage, and other harmful practices for women and girls, and promoting sharing of household and caring responsibilities between women and men and transgender persons. These are some of the policy recommendations that could be undertaken not only to recognize, reduce, and redistribute the overload of unpaid work taking place at home, but also to ensure their overall safety and well-being during this difficult time for everyone.